Steve Johnson became one of the multitudes of Americans wondering about a new weight loss medicine called Wegovy towards the end of the summer. The medical product salesman had been sporadically fasting and increasing his exercise, but the roughly 27 kilograms he intended to shed were not disappearing. He looked up Novo Nordisk's medicine statistics, was intrigued by the average 15% weight reduction recorded in clinical trial participants, and phoned his doctor in August. He informed his doctor that the once-weekly dose of Wegovy could be just what he needs. If he could only get his hands on it. The possibility of a pill that could make you lose weight in a healthy way just like exercise would, may soon be a possibility. In this episode, I will talk to you about what the future losing weight might look like. The demand for Wegovy, which was authorized by the U.S. Food and Drug Administration in early June, caught Novo Nordisk off guard. People are sharing advice on where to locate dosages in stock on social media groups, as well as mourning when they can't find the medicine. According to company executives, clearing the backlog might take until the end of the year. The demand for Wegovy, according to many business, government, and university scientists who research metabolism and appetite, underscores the need for safer and more effective weight loss medications. Doctors have been cautious to administer these products, and corporations have been reticent to invest in creating new ones, in a profession plagued by medications with hazardous side effects and product recalls. The introduction of Wegovy and a few other medications in recent years has coincided with a shift in the medical complexes and pharmaceutical industry's understanding of obesity, a contentious term defined by the U.S. Centers for Disease Control and Prevention as anybody with a BMI of 30 or more. Obesity was once thought to be a behavioral problem. Many people now regard it as a chronic disease that needs ongoing therapy due to its ties to other disorders such as diabetes, heart disease, and high blood pressure. Researchers from Baylor College of Medicine, Stanford School of Medicine, and other institutions have discovered a chemical in the blood that is created during exercise and can successfully lower food intake and obesity in mice, according to a study published today in the journal Nature. The findings add to our knowledge of the physiological pathways that underpin the exercise-hunger interaction. Dr. Yang Xu, professor of pediatrics, nutrition and molecular and cellular biology at Baylor, stated, "Regular exercise has been proved to promote weight loss, manage appetite, and enhance the metabolic profile, especially for patients who are overweight and obese. If we can figure out how exercise causes these advantages, we'll be one step closer to helping a lot more people improve their health." They wanted to know how exercise worked at the molecular level so that they might profit from it. For example, aged or feeble persons who are unable to exercise may benefit in the future from taking a medicine that can help slow down the progression of osteoporosis, heart disease, or other diseases. Xu, Long, and their colleagues analyzed blood plasma components in mice after they ran on a treadmill for an extended period of time. LAC-Phe, a modified amino acid, was the most strongly stimulated molecule. Lactate, a result of intense activity that causes a burning feeling in the muscles, and phenylalanine are used to make it, an amino acid that is one of the building blocks of proteins. A high dosage of LAC-Phe decreased food intake by around 50% in mice with diet-induced obesity, given a high-fat diet, over a 12-hour period compared to control mice without influencing activity or energy expenditure. LAC-Phe lowered cumulative food intake and body weight due to loss of body fat and enhanced glucose tolerance in mice when given for 10 days. The researchers also discovered an enzyme called CNDP2, which is involved in the creation of LAC-Phe, and demonstrated that mice missing this enzyme did not shed as much weight on an exercise program as a control group. Surprisingly, the researchers discovered significant increases in plasma LAC-Phe levels in racehorses and people following physical activity. Sprint activity caused the greatest rise in plasma LAC-Phe, followed by strength training, and finally endurance training, according to data from a human exercise cohort. This shows that LAC-Phe is an old and preserved system in many animal species that controls food and is linked to physical activity, Long said. Safe and effective weight loss medicine has enormous financial potential. In the United States, around 42% of adults fit the CDC's criteria of obesity. People with metabolic illnesses who have a lower BMI are eligible for either Wegovy or Saxenda, liraglutide, a shorter-acting form of the medicine that was authorized in 2014. Treatment for chronic weight control might take years, if not decades. In 2020, sales of Saxenda, a daily pill that normally results in modest weight reduction, totaled more than $900 million. The development of weight loss drugs has had a rocky past. Side effects have plagued goods since their inception, ranging from high blood pressure to mortality. The difficulties began in the 1930s, when 2,4-dinitrophenol was introduced as one of the earliest weight loss chemicals. DNP is a mitochondrial uncoupler that works by interfering with the mechanisms in our bodies that produce and store energy. Because there is nowhere for the energy to go, it is released as heat, resulting in weight loss. It can also cause uncontrollable rises in body temperature, and current regulatory bodies have never authorized the medicine. People may still acquire DNP on the internet, and a dozen people died after taking it between 2001 and 2010, including a 28-year-old man who was using it for bodybuilding. His internal body temperature reached 106 degrees Fahrenheit. Weight loss medicines authorized by the FDA in the 1960s were all derivatives of amphetamine, which reduces appetite. According to physician Daniel Bessison, a researcher at the University of Colorado Anschutz Medical Campus, one of those medicines, phentermine, is still commonly given. On average, people who take phentermine lose between 5 and 10% of their initial weight. It's the greatest accessible alternative for patients whose insurance won't pay medications like Wegovy, according to Bessison. However, because this family of medicines is addictive and can induce dangerously high blood pressure, they should only be used for a few weeks at a time. There was a long period of no new weight loss medications in the 1970s and 1980s. Dexfenfluramine, a stronger variant of the previously approved weight loss medication fenfluramine, was approved by the FDA in 1996. Both medicines belong to the serotonergic anorectics class of appetite suppressants, which function by reducing serotonin levels in the brain. Doctors have already combined phentermine and fenfluramine in the infamous fen-phen combination. Then there were reports of heart valve injury among fen-phen users. Fenfluramine and dexfenfluramine were taken off the market by the FDA in 1997, kicking off a whirlwind of regulatory rejections, approvals, and withdrawals for weight loss medicines. Meridia, sibutramine, was authorized by the FDA in 1997, but it was taken off the market in 2010 due to negative side effects, including an increased risk of heart attack. Rimonabant, the first cannabinoid receptor 1 blocker licensed for weight reduction in Europe, was revoked 2 years later because the medicine was connected to suicidal ideation. Belvic, lorcaserin, a tiny chemical that activates a serotonin receptor, was withdrawn off the market in 2020 after 8 years on the market due to evidence that it increased cancer risk. AstraZeneca is also working on a dual agonist diabetic medicine, which industry experts are keeping an eye on since tests show that, too, promotes weight reduction. The chemical, known as cotatatide, operates on both the glucagon and GLP-1 receptors. Lutz Germudis, the head of AstraZeneca's metabolic illness division, downplays the impact and says the business isn't planning to utilize the medicine for weight reduction right soon. The business is instead concentrating on ailments such as non-alcoholic steatohepatitis, NASH, and chronic renal disease. Brett claims that Wegovy isn't the end of the road for Novo Nordisk. The business is also evaluating whether Rybelsus, an oral form of semaglutide, may help people lose weight, and it has a lot of money invested in combination medications that include semaglutide and an amylin analog. Brett, like others, believes that the recent surge in weight loss medicine development is encouraging. So, what is your opinion on potential future pills for tackling weight loss? Please tell us your opinion in the comments section below. I would love to hear what you have to say about it. Thank you for watching Longevity News. We consistently report on the newest biotechnologies and supplements around longevity on society's path to curing aging. Please support our cause by liking this video and subscribing to not miss out on any new videos.